Hello, everyone, and thank you for having me here today. My name is Lydia O'Meara. I'm a nutritionist and a PhD student with the University of Greenwich in the UK. So today I will be sharing some preliminary results and our research experience, protocol, and lessons learned from conducting remote diet data collection, that is using interactive voice recordings or IVR on mobile phones in Uganda. So I am presenting today on behalf of the broader team. So I would like to first acknowledge all the different institutions and individuals involved in this multi-phase study. In particular, my kind thank you to our partners in Uganda, so Africa Innovations Institute, Ituli Institute, Sasakawa, and more broadly, Engage Spark, for your kind hospitality during my time in Uganda and your continuing collaboration on this project. So let's get into it. By way of background, as you would all be aware, all of those of you in the room today, there is a global need for more diet data. And to state the obvious, we all understand that nutritious diets are particularly essential for health. And what is coming through currently is that diet quality is actually one of those key indicators that's being used for assessing food system changes and also for monitoring our global progress on the Sustainable Development Goals that are just around the corner in 2030. In more detail, however, at the individual level, there is a real scarcity of diet data. And this is no surprise because collecting dietary data, as you probably know in your own experience, can be expensive and time-consuming. In particular, there is a real lack of seasonal data. That is that seasonal changes in food insecurity that is not captured currently by those large 4-yearly national cross-sectional surveys, such as the demographic and health surveys, which are amazing. We all rely a lot on that data, but we still know there is quite a lot of gaps, especially at that seasonality nuance level. So in conclusion, we need more diet data. In particular, we need this so that we can develop more timely, equitable policies to improve food security and nutrition as we forge ahead to the 2030 SDG goals. However, there are some very hard to reach population groups. And I would like to reassure everybody, this photo is from the internet. It is from Northern Uganda, but it is not of our research teams. This did not happen to us. But of course, it's one of those photos that does resonate with us as research teams because sometimes the environment has other plans. So globally, we have a lack of dietary data, but there's an even bigger gap in this dietary data for these really hard to reach population groups. And this is in particular for when we use a numerator or face-to-face methods. Some of these groups are geographically remote. There is challenging road infrastructure, and there is the high cost of vehicles, and in our current context, the ever-increasing cost of fuel. And then add a few other variables on top of this, like the wet season and a little extra rain, and you can end up with some interesting challenges and a lot of mud. So what about internet-based methods? What about sending an online survey This is well and good for people who have access to home internet or have a smartphone and can afford the corresponding data costs, and assuming that they are literate and can read and respond. So internet is not always a good solution either. And in particular, I know from our own experience, everyone in the room, you'd know from your experience, collecting dietary data can be harder in some periods, whether that be the wet season or certain disease outbreaks where there are mobility restrictions because of the risk of infection, such as what we experienced during the COVID-19 pandemic, or even during the Ebola outbreaks, and there was one in 2022 also in Uganda. But what is more concerning is during those periods where it's harder to access these population groups is actually when their food insecurity and their dietary quality is actually most at risk. So we have a bit of a dilemma here. So what potential does remote mobile phone data collection offer us in this situation? From what we can see, it has the ability to improve the timeliness and the frequency of collecting dietary data, which could then complement the DHS or some of those other 4-yearly cross-sectional national level surveys. It has potential to reduce costs for some of that high frequency longitudinal data because it transcends some of those enumerator in-person expenses. It also potentially could be used for monitoring remotely environmental policies and its effect on dietary intake, or tracking what is happening to dietary intake during agriculture and nutrition interventions. And could it actually be used as an early warning system for monitoring diet quality changes for what we just discussed, those hard to reach population groups that are during high risk seasonal food insecurity periods, such as the wet season, which is otherwise known as the hungry season, or infectious disease outbreaks where mobility is restricted and food insecurity often goes up. Despite these mobile phone potentials, there is currently a lack of validated tools for remote diet data collection. But what you might be wondering at this point is, what is the actual mobile phone ownership, use, and coverage in low and middle income countries, and in particular in women who are a nutritionally vulnerable, often targeted group? Well, as you can see from this map here from the Mobile Gender Gap Report, women phone ownership is actually as high as 81% in low and middle income countries, and can be as high as 69% in sub-Saharan Africa. However, as your common sense would indicate, there would be pockets where it's higher, more likely in urban areas and amongst higher socio-demographic population groups. And when we drill down into this a little bit further, we did find that in Eastern Uganda and Northern Uganda, the areas that we worked, that mobile phone ownership was as actually quite low for women at 39% and 28%. So, but despite these immediate challenges, we do find that mobile phones or telecommunication is the fastest growing two-way communication channel in low and middle income countries. And it does have potential to be used in different contexts, as long as you take into account some of these differences in ownership and experience. And also, it's one of the fastest growing. So it has potential into the future as well. So how has mobile phones been used in the past? So from an interactive digital data platform, it has been used a couple of times. In high-income countries, for example, they've used mobile phones to monitor chronic pain symptoms in patients and to then adjust treatments. It's also been used for monitoring alcohol consumption, and they actually have found that using these mobile phones has reduced underreporting compared to face-to-face conventional recalls because people find it more private. In low and middle income countries, so let's go to Kenya. There's a really great example very recently from COVID-19, where they found that they could actually give smartphones to what are traditionally nomadic population groups in Western Kenya. And these women were weekly and monthly putting in the nutritional status data or the wasting data on their children. And this was coming through during COVID-19. Very fascinating study. And then in India, mobile phones have been used for receiving student feedback on the school feeding programs. And also it's been used in agricultural settings for providing on-demand agricultural information for farmers. So as you can see, nothing dietary data connected just yet, but it has been demonstrated to have potential. So what was our research question? So overall, with the IMMANA project, and this encompasses phase 1 and phase 2, which was across multiple years and multiple districts, the research question was to assess what is the feasibility and the validity of collecting dietary diversity data remotely using interactive voice recordings, that is the computerized IVR, on mobile phones, compared with the traditional face-to-face enumerator methods. And in particular, what is this like with hard to reach population groups across different seasons and in 2 different regions of rural Uganda? So in picture format, we were essentially comparing what's the dietary diversity collected by our very traditional face-to-face enumerator methods, and we'll come to more details on that, versus the dietary diversity that we're going to collect remotely using mobile phones as our innovative digital tool. So here we have a map of Uganda. One half of the IMMANA study was conducted in northern Uganda. This is where I conducted my field work, and this was during the wet season in 2022. And this was in Apache and Kwania districts. And then the previous IMMANA phase was conducted in eastern Uganda. This was during the dry season in 2018, and this was in Kamuli and Bugiri districts. So I know this is an overwhelming slide with lots of information. In the interest of time, we're not going to go through every detail on this slide, but it's simply to demonstrate that because this IMMANA project has been conducted in phase 1 and phase 2 across these 2 different time periods and districts, it really provided this project with a unique opportunity to test and trial and adjust this protocol. So the protocol that I'm going to then present to you in the next couple of slides is essentially the one that has been refined with great trial and error to a point where we've gotten it to a really high completion rate. So it's just to demonstrate that this is not something that we successfully managed to figure out straight out of the gate. This was something that has been developed over time. And the big main differences between the two phases was that in phase one, the team originally tried a same-day diet diary. So the women were called 3 times over the one day, and they were reporting what they and their child ate during the day. And essentially there was a lot of network connectivity issues, and it increased the length of everything. So the completion rate was not as high as we would have liked. But this did give a lot of valuable feedback and information and lessons learned, so that when we went into the field in northern Uganda, we were able to invest a considerable amount of time in the formative research to refine the protocol. And we then used a more simplified version, which we will go into details in the next slide. So this is the refined method that we used in northern Uganda. So we use the computerized interactive voice recordings on very basic push button mobile phones. We used the 24-hour list-based dietary diversity recall, and we matched this exactly based on the Uganda Demographic and Health Survey, or the DHS Phase 8. That's the most recent version. We did this so that we're using a very standardized version of the list-based dietary diversity recall. And because then the data that we collect can be compared to that which is collected at the national scale. We generated the phone call for one call in the day, and that was approximately late morning. And that one phone call asked the questions for what was eaten in the previous 24 hours or the day before. And when the women responded, they responded to the yes/no questions using the keypad on the mobile phone. So for yes, they pressed 1, for no, they pressed 3. On average, the phone call took 23 minutes. Now, this was much shorter than what was trialed in Eastern Uganda, but from our experience and the feedback from the women, we would say even this was potentially too long, and shorter calls under 20 minutes is definitely more beneficial. At the end of the day, we achieved a 74% IVR completion rate, which we're very happy with. This is very high. These women were highly engaged, and they were going and completing the call all the way through to the end. We then validated the mobile phone dietary diversity against weighed food records, which is the gold standard for validation studies. And these weighed food records were collected on the same day. So we're comparing the same day for the weighed food record against the mobile phone 24-hour recall. We also compared this against the enumerator-led 24-hour diet recall, or the very traditional face-to-face method. But it's important to note that, especially for northern Uganda, this was on a different day. So let's get into the finer details. So when it came to the actual protocol or procedure in northern Uganda, this is how it played out. So first, before we started any data collection in any villages, we dedicated a whole day aside, or half a day, to the sensitization workshop. And we found that these workshops were really, really important for communicating with the village leaders, the women and their husbands, on what was the purpose of the study, their chance for them to see the mobile phones, listen to the recordings of the survey on the mobile phones so that they understood you know, whose voice it was. It was a female voice in the Blango. It was questions about what the mother and the baby had eaten the day before. We did these demo calls that were approximately 3 minutes, and we found that it was incredibly helpful for engaging the village as a whole, so they understood what the project was about and what it involved, so that people were more comfortable. And then on the actual day of data collection, early in the morning, the team would drop the mobile phones off to the women. So every woman was given a number, and then that number was then, of course, designated to a mobile phone. So we knew which mobile phone went with which woman. When that phone is dropped off by the team, they would call a Ugandan phone number provided by the Engage Spark platform, and this would trigger a flash call. So it costs no money to do this trigger flash call, but it would communicate with the Engage Spark platform, and it would automatically instruct the platform to call back with a 3-minute demo call. And we found that this demo call was really important for, one, making sure that the audio on the mobile phone was high enough, and making sure that the woman was comfortable. She could confirm that she could hear the questions, she could understand the questions, and in particular, it gave her an opportunity to practice pressing 1 and 3 on the keypad. And we actually found that we had to press quite firmly on the keypad for the response to register with the Engage Spark platform. So it was a good opportunity to practice pressing that button, so the woman knew how hard to press so that her responses registered. We then made sure to give the woman a waist pouch that she could clip around her waist. These women are extremely busy. They are working all day in the garden. They can't carry a phone around in their hands. And if they put it down, you know, there's a chance that someone else might pick it up. So giving them the waist pouch to put the phone in, they could carry it with them discreetly. It was much more comfortable. And it meant that when the phone call rang, the woman could hear it and pick it up. So we found that it was a very simple thing, but it actually had a huge impact on the success of the project. We also found it was important to remind the woman of the length of the survey, to remind her this is the order that the questions will come in. Please stay on the phone call until it gets to the very, very end. And then approximately late morning, or more precisely, exactly 1 hour after we've triggered that flash call, the Engage Spark platform knows to then call that woman with the main survey. So, and assuming she has that phone in her pouch, she hears it ringing, she picks it up, and then she listens to the questions and answers them on the keypad. First, she would answer the question about what the child ate the day before, then what she ate the day before, and then a couple of questions at the end about hand washing. She would finish the survey. She can carry the phone around in the pouch for the rest of the day, and in the afternoon, the team would go back to pick up the phone and the pouch off her. And then from the research team perspective, at the end of the day, we could then go on to the Engage Spark platform, and we could download a pre-populated Excel spreadsheet with all of the data. We could see what phones had been called, at what time, how long the phone call took, how many questions were answered, and of course the response. And you can see here, you can see ones, you can see threes. So this is 1 is for yes and 3 is for no. So you can see really quickly what the data is looking like. So what did we find? The million-dollar question. So in Eastern Uganda, some of the data has been analyzed for the children's dietary diversity. So those are those children that are 12 to 23 months old, or during that that complementary feeding period. So preliminary results indicate that at the population level, there is no statistical difference in the dietary diversity scores or the percentage of children meeting the minimum dietary diversity between the methods. Now, this is ultimately good news because it means that the results are comparable or similar between the weighed food record observations, between that's collected on the mobile phone using the computerized IVR, and then compared again to the numerator face-to-face 24-hour recall. So right now, the mobile phone method is holding up at the population level. However, it is worth noting at this point that the mobile phone method appears to be slightly underestimating the dietary diversity score and as you can see here, it seems to be underestimating by one whole food group. Now, further sub-analysis is being conducted to tease out why some of this might be. So we'll go to the next slide. So for northern Uganda, the women's dietary diversity, the preliminary results also indicate, and we're seeing similar patterns here, that at the population level, there is no statistical difference in the percentage of women that are meeting the minimum dietary diversity of 5 out of 10 food groups between the mobile phone IVR and the enumerator-led 24-hour recall. So this is good. We're seeing consistent results between Eastern Uganda with the children compared to the women in Northern Uganda. Now, it's worth noting that this is very preliminary results. We haven't compared this yet against the weighed food records, which is the gold standard. That's because, but the picture is starting to come out here. However, it's worth noting again that the IVR appears to be slightly underestimating the dietary diversity score. Now, some of our preliminary sub-analysis appears to indicate that some of this might be due to underreporting of vitamin A rich fruits and vegetables. So those are those orange fleshed items such as ripe mango or orange flesh sweet potatoes. So it'll be interesting to see if this is one of the consistently underreported food groups. And then, of course, what could be done about it to help women respond more accurately to this question. So from an acceptability perspective, in good news, we found that the majority of women, or 97 to 98% in both phase 1 and phase 2, said that they would be willing or happy to use a basic mobile phone for reporting dietary intake in a future study. But let's dig into this a little bit deeper. From some of their comments that we received in the exit questionnaire, a few of them mentioned it is easy to use. This is great. This is what we want. Another said it was easy to hear and understand the questions. We worked really hard on making sure the questions were simple and translated correctly, and making sure that the phone volume was up high. So it's good that this translated through to the feedback. And another woman said, excited since had never used a phone before. So even though we were working with a population group that had a history of less experience with mobile phones, it didn't hinder their desire to interact or use it. And in fact, they were very engaged. From a more reflective perspective, there's a few things we need to take note of. There was quite a few that said no call received due to poor network, and we will cover this a little bit more in the coming slides. Network connectivity, of course, is a challenge, especially in some of these remote areas. Phone call was interrupted by a child. I think any of us who have children can relate to this comment. Life goes on. So, of course, the shorter the survey can be, the more likely that you are to get a full completion rate. Another one that came back, phone call took so long. Each question was being repeated twice. Now, this, in all likelihood, would have been because the platform was not registering the woman's responses. So this was one of those situations where we knew that the phone keypad needed to be pressed more firmly or harder so that her response was registering. This just demonstrates again that importance of allowing time to interact with the woman, allow her to interact with the phone, make sure she's comfortable using it, and how hard you have to press those keys to get that communication happening with the platform. So overall, our lessons learned, we found that the strength of using this computerized IVR mobile phone method is that it does make it possible to do remote diet data collection. We demonstrate this during the wet season, but it could also translate to other situations where there's mobility restrictions or population groups are nomadic. We also found that it's feasible to use this method with marginalized groups that have low literacy or low mobile phone experience. As long as you factor in that time, these are barriers that can be overcome. It can be considered quite confidential. People are inputting their information anonymously. It's less intrusive. And because it's computer generated, it is lower cost compared to the more resource intensive enumerator, face-to-face, vehicles, fuel, travel time methods. However, we did find that there's a few things to be mindful of. In particular, there's no ability for the participant, or in our case, the woman, to interact with the enumerator to clarify what the question means. So we invested a considerable amount of time into making sure that these questions were simple. The questions were short. We needed to refine the translation. We refined the translation more times than I think we anticipated. Because it's really incredibly important that these people or the participants can understand the question intuitively. There is really low mobile phone ownership and low literacy in some hard to reach, marginalized population groups. So in our situation, this meant that we needed to provide project phones. And we also needed to allow time to teach some participants how to use a mobile phone, what to know, which button was 1, which button was 3, because they didn't necessarily know how to read numbers. We found that everyone was highly engaged, they learned really quickly, they wanted to learn, but it does mean that you need to account for this in your project costs if you are targeting those hard to reach population groups in, say, really rural areas. It's also important to really consider the ethical issues and the safeguarding of respondents. We can't encourage you enough to invest extensive time into that formative research component to refine the protocol to the local context. So we found, for instance, in northern Uganda, that a woman using a mobile phone in the evening might be construed as her talking to another man, or mistaken for talking to another man or a boyfriend or something like that. So we found that it was really important to record the survey using a woman's voice. It was important to demonstrate to the men in the village that it was a woman's voice that was coming through on the phone call, and that it was questions that were quite benign about what was being eaten. We also found that this was one reason, because that risk around mobile phone being used in the evening was higher in the evening. This is why we scheduled the call for the late morning. And it's also one reason why we dropped the phones off at the beginning of the day, and then we made sure to collect them at the end of the day, so that the time that the woman did respond, was carrying the phone and responded to the phone call, was during the daylight hours, which was safer for her. And it also helped to mitigate against any accidental misunderstandings. And of course, there was low connectivity. This will come as no surprise to anyone. It's one of the challenges that comes up everywhere. We found that, of course, there is different regions that have better coverage with different network providers. So we bought multiple SIM cards under multiple providers. And this meant that when we went to a village, we confirmed what was the best network provider for that village or for that household, and that influenced what phone with what SIM card was given to what woman, and that did help a lot with the connectivity challenges. The other one was scheduling repeat callbacks in the Engage Spark platform until the survey is complete. So for instance, say the woman has successfully gone through a third of the survey, and then the network drops. Then the Engage Spark platform remembers what question she was up to. It calls her back. She can pick it up and she can keep going on with the survey where she left off. And this did help. These repeat callbacks did help some women get all the way to the end of the survey. And at the end of the day, what did all of this cost? So we use the Engage Spark digital mobile phone platform provider. These numbers are from 2022, so of course these could be subject to change, and it's just to give you an indication of approximate costs. So we budgeted 13 cents per minute. Our average survey phone call was 23 minutes. We were working with 156 women, and we scheduled one call per woman. So I'll let you do the calculations, but of course the big ticket item here is the 13 cents per minute. And of course our calls were approximately 23 minutes on average, but based on the feedback from the women, it would actually be preferable to have a survey that is shorter. This has potential upsides because it would increase your completion rate, potentially increase your data quality, and of course would lower the costs again. But of course it means that you need to invest a lot of time into making sure that survey is really on point and simple. The other thing to take into consideration is Engage Spark, for instance, charges a monthly account fee, which back in 2022 was $30 per month. And for our validation study, we needed to pay this for approximately 4 months. Of course, if you're doing a high frequency longitudinal study, you would need to allow a bit more budget for those ongoing monthly account fees. And of course, this is just with Engage Spark. This is just one example of one platform provider that we have worked with. There are multiple platform providers, so the costs can vary considerably. In conclusion, the key take-home message is that based on this IMMANA study, our preliminary results indicate that the IVR, or the computerized interactive voice recordings on mobile phone method, appears to work well for one, collecting diet data remotely, and we demonstrate this across 2 seasons, across 2 different districts. And it also appears to work well for determining dietary quality at the population level. Now, of course, this comes with the usual caveats. We have demonstrated this in Uganda, in women and children in the northern and the eastern districts, and across the wet and the dry seasons. But of course, a lot more research needs to be done to refine this methodology. But overall, it is encouraging to see that the preliminary results are coming through fairly consistently, that at these two points for determining dietary quality at the population level and for collecting dietary data remotely. And of course, the one thing to keep in mind with all of this is that the dietary diversity score, when it was first developed, was validated for monitoring population level dietary quality. It's not appropriate for individual level due to day-to-day variability. Other potential strengths that we identified during this study is that the IVR has potential for collecting high frequency diet data that could make it more affordable over time. It can be and is feasible for use with hard to reach nutritionally vulnerable population groups, which in our case was women of reproductive age and their young children. It has potential for remotely monitoring diet equality when physical access is difficult or expensive. So such as the wet, hungry season, during mobility restrictions associated with disease outbreaks like COVID-19 or Ebola, for monitoring conservation policies or the effect of agriculture nutrition interventions. And lastly, here are our contact details and some resources that might help you on your IVR mobile phone journey. We can provide a copy of this presentation and of course the PowerPoint after the workshop. And ultimately, thank you for listening today. Webelinyo, apoyo, and happy to take any questions or feedback that you have. Thank you.